So what are these neglected diseases? Well, there's the big three. That's HIV/AIDS, which is a virus, tuberculosis, which is a bacterium, and malaria, which is a single-celled protozoan parasite. And they cause round about plus or minus 1 million deaths every year, and they afflict, half the population of the world are at threat from them. And then some people call those the big three. WHO doesn't even list them as neglected anymore, but I would disagree on that. And lists 17 other diseases, and there are viral diseases, bacterial, helminth, and 3 protozoan diseases. These are the trypanosomatids, which I'm going to focus on now, because that's what the Drug Discovery Unit works on in particular. And they're responsible for 3 diseases. So I've brought along, since I'm not allowed PowerPoint, I thought I'd bring along a parasite. So this cute little fluffy thing, which you can get from, I think it's called Monsters Inc. or something like that, is an African trypanosome. And the African trypanosome, which has a nice wiggly tail, that's actually its front, it swims that way, not where the cute little face is. This one is spread by a biting fly called the tsetse fly. And the tsetse fly is about the size of a horsefly and about as painful if you get bitten by it. So after being bitten by the infected tsetse fly, the female tsetse fly is looking for a blood meal in order to complete its own life cycle. And to prevent the body from coagulating round the mouth parts of the insect, they secrete saliva, which prevents the blood from clotting and so on. And in some cases, they secrete peptides that reduce the pain. So the parasite gets into the body, and then after a while it spreads to the bloodstream. But it's called sleeping sickness. And the problem is, once this parasite gets into your brain, then you get the serious effects of sleeping sickness. So the next parasite is called Trypanosoma cruzi, and you'll notice it's a slightly different shape. That's what it looks like in the bloodstream, roughly speaking. It's S-shaped. And this parasite causes Trypanosoma cruzi. Now, this one hides inside cells to avoid being detected by the immune system, and in particular it likes to go for the heart. So some people die very early from the infection, and that those who survive the initial infection can remain perfectly well for the rest of their lives. But about 1/3 of them will get serious heart disease of various types and that die from it. So this one's mainly from South America, and it's spread by a very large bug, about this big, called the kissing bug or the assassin bug. And you can read about it in The Voyage of the Beagle, how Darwin slept in a hut and was surrounded by these bugs. And one theory of his continued chronic illnesses thereafter was that he developed Chagas disease. So, anyway, enough on that one. So our next parasite, it's a cute little fella, is the Leishmania parasite. And it has a flagellum, so it travels in that direction again. And this is the insect stage. It's actually rounded up like a little ball. It looks rather like a kernel or a seed. When it invades white blood cells, the macrophages, the scavenging macrophages of the body, and instead of being killed, it lives there in this acidic, proteolytic environment, very hostile environment, and it can live there very nicely in your liver, spleen, and bone marrow. And people who get this disease are particularly in Asia, Eastern Africa, and in Latin America.